Hello, good afternoon. In this video, I'm going to show you a demonstration on how to get started with our CarePro Health Record Management software. That's the EMR system. So our CarePro is a digital health management platform to help you connect with all your departments, processes, and workflows within your healthcare facility. So it's going to help you to automate and digitize healthcare management. So the first thing you do is come to this URL, carepro.com.ng. So once you get to the URL, you can now log into the system. So in this login, I'm going to show you some brief features or brief information about the key features that we have in the CarePro system. So I'm going to log in now. Once I log into the system, it's going to take me to the home page, which is the dashboard. As you can see, this is the dashboard of the healthcare system. So we have the dashboard, we have patients, we have calendar, workbench, admitted patient, billing, payments, contact, settings, reports, products, and services. So the first thing that you do when you come to this system for the first time is go to the settings. So on the setting, you'll be able to set up some parameters that you will use in running the system. So like the users now, I need to set up users. I'll use the system by giving them their username and password and the category of access you want to give those users. So as you can see here now, you can set up user based on different category: cash reception, cashier, nurse, accountant, marketer, consultant, doctor, pathologist, and the rest. So you can set up user on those categories. Also, we have departments. This is where you set up your departments that you are running within your facility, like medical service, operation theater, dietary, nursing, laboratory, and so on and so forth. So you just set them up so that you can use it in setting up your service and pricing. So the next thing that you do is services. After setting up department, so the services allow you to set up your services and the price for those services. So that's what the service is all about. So you just create new service, you put the service name, description, and the service cost that will be used during the billing for patients. So that's what that is all about. As you can see, you pick the department, the service name, and the cost of the services, and you submit those services. The next thing that you have there is the products. The product is used in case if you are selling products like a retail product like drugs and other things that you use in serving your patients. So you can add those products here and their pricing, the quantity of product that you have, the expiry date, the unit price of the product, and the quantity balance that you have in your inventory. So you'll be able to set up your product from here by clicking on the new product. Another thing that you have there is the organization. Organization are the people that work with the health center, like people that refer patients, or people that like HMO, or the companies that refer patients to your facilities. So you'll be able to manage them, yeah, and the referrals as well. You'll be able to manage them. Then we have the wards, rooms, and bed. You'll be able to set up your ward, your rooms, and the bed that you have in your facility in case of admission, so that you're able to manage vacant spaces and the rest within your facility. Then we have surgical procedures. This will help you to add all your surgical procedures that you are running, all surgeries that you are running within your facility. So, and we have operating theater. This is the theater that you use in carrying out surgery and operations. You should be able to set up all those informations within your CarePro system. So that's what we have on the settings. As you can see, we have all those these surgical procedures already added to the system. So you can schedule procedures for patients at any particular time. So the next thing that we now do is patient. Go to patient menu. That's where you'll be able to manage everything about the patient. Okay. So when you go to patient menu, you will see all the patients, and you can do overview, visit, billing, appointment, notes, medication, documents, and consent. So if you want to create a new patient, you click on the, if you look at the top of your page, the top right of your page, you will see the create new patient there. That is where you'll be able to create a new patient in case for registration. So on that page, you will be able to add the surname, other name, gender, marital status, date of birth, the phone number, email address, ethnicity, and the rest. So to create your new patient, this is the patient registration form. So after creation of form, then you can now attend to patients. On your patient page, you have overview. Overview is where you are going to see all what the patient has come to do, like the timeline of the patient within your facility. With the overview, you can see everything on a page. You can see the patient details here. You can see the consultation that has this is the most recent consultations that patient was taking. The health charts. You can see the fighters, prescription, medication, admission, food intake, food output, billing, payments, visits, appointment, and so on and so forth. So you can see everything on a page. That's why we call it patient overview. Then you have visits. If you want to add a visit, when the patient comes into your facility, you click on add visit to add the patient to the facility. So anytime the patient comes in, you click on facility type, visit type, either for consultation, appointments, and so on and so forth. So you can pick the visit type, the department that the patient is going, visit time, the time that the patient visited, then the clinician, that is the doctor that will attend to the patient. That's why we have the patient visits. You just submit it, and that's all you need to do. Then we have the billing. The billing button is where you bill patients for services to be carried out. So it allows you to pick services and bill the patient for the services. Like the billing reference, if it's a self-payment, referring organization none, then referring data none, so you continue billing. So on the page, you can select the services or products that you want to bill the patients. So you can add services or a product that you want to bill the patient for. That is the billing section. So after billing, the patient will now go to the cashier desk to make the payments. That's how that goes. So once you do the billing, you generate an invoice, and the patient can go ahead to pay the payment. So this is the payment page. So you just pick and post the payment here, so that you can print out the receipts for the patient. Once you print out the receipt for the patient can go on to the service centers where they can give or render the service that has been paid for. So that is how it works. So once you have done that, the next thing you can do on patient tab, so we have generated the invoice now. So this is the payment receipt. This payment receipt that can be printed out on POS printer. So that's the receipt. As you can see, then we have then after that, if you go back to the patient, you will see appointments. In case the patient wants to come back for another time, you cannot book the appointment for the patient. So the appointment page will allow you to select the appointment date, appointment time, and the consultant that the patient is going to see. That's how the appointments work. And if you go to your appointment calendar, you can see all the appointment that has been booked for a particular period. Then we have notes. A note is where you can add informations about the patient that is needs to be shared across departments, so that anybody that open the patient record will see the note there, and if they are to take action on it, can take action on it on the note. Then we have medication. Medication is where drug is being dispensed to the patient. So this is for the pharmacy to use. They pick they can enter the drug given, the dose, the frequency, the duration, so they can submit it on the system so that they can have a record of the drug that has been given to the patient. Then we have documents. So the document is the electronic document of the patient, like the forms, lab reports, medical reports, payment confirmation, requisition letter, medical forms, and history. So you can store all those documents here. Now let's go to the visit now, so that we can see what is on the admission. If you have visits for a patient now, let's say the patient comes for physical examination, for example now, and you click on medical service, clinician, then you submit. So once you do that, a doctor or a nurse can attend to the patient. So once you add visits for a patient, you are going to have them on your workbench. You can see the workbench now is having one visit. So if a doctor or a nurse needs to attend to a patient, you go to the workbench to add. So you can see my workbench now. I can add vitals, consultation, skin analysis, medication, procedure, antenatal, and immunization. So I can add all these medical data for the patient. So I can add vitals, like physical examination for the patient, like new physical examination. Then it's going to show you all the details that you need to add. Like we have the vital sign, skin assessment, head, eyes, ears, nose, and throat. We have the neck, lung, heart, abdomen, extremities, neurological and social determinants of health. So all these are the vitals that can be taken for a patient for every visit that the patient made to the center. So this one will show up on the health chart of the patient. So we also have consultations. Consultation is where the doctor will meet with the patient for consultation, clinical condition, complaint, diagnosis, treatment, medication, and diagnosis. So this is where the doctor will take notes of all those informations of the patient, so that it can determine the condition of the patient and the treatment the patient required. So this is the consultation page for the doctor to use. So you can use this one. You can also use that to set up admission. Once the patient require admission, you pick the admission yes, and you can book the patient for admission from that on that page. So that's the how the consultation page work. So then the next thing you can do is skin analysis, medication, procedure, antenatal patients, antenatal patients. Yeah, that the you can set up your antenatal here, and also the immunization for the children. So that's the what you can do on the workbench. Then if you go back to your overview, you can see all what the patient is been doing within your facility. So I think okay, that's the then on this page you can see the admitted patient, the billing, all the billing that has been taken. You can see all of them here. You can also see payments that has been posted within the for the account department. So they can see all those payments here as well. So that is the thing for this demonstration. So I'm going to stop here now for this section of a demonstration. So in the next section, I'm going to go deeper on how you can do consultation for patients, on how you can manage all those consultations, how you can update them, and do some other things within the CarePro system. Thank you very much for listening to this demonstration. So I hope you can look forward to the next